Hello and welcome to the Nutritank podcast, where we interview leading experts within the field of food systems, nutrition, and lifestyle medicine. Our aim is to empower you, the next generation of healthcare professionals and change makers. We believe that the valuable knowledge and experience of our guests will inspire you to act and join the movement in creating a healthier population.
Hello, Nutritank Network. We hope you enjoyed our last episode where my co-host Luke spoke to Dr. Laura Marshall-Andrews, a GP who has written a book about her pioneering and radical general practice in Brighton, UK, that pushes the boundaries of medicine and what patients can expect, prioritizing the lived experience of patients and taking a holistic approach. For example, providing opportunities to take part in dance classes, art, and wild food foraging to help patients manage complex medical and mental health conditions, as well as helping to tackle societal problems such as loneliness, which is one of the biggest health challenges of our age. It is an interesting episode for sure, and inspiring to hear Laura's story, which is an urgent call for the NHS to change at a time when it is most needed. So please do go check it out after this episode. Welcome to today's episode of the Nutritank podcast. It is our final episode of this season, so thank you to all our listeners and those watching along on YouTube. We hope you have enjoyed the journey alongside myself and co-host Luke, gaining some valuable insights from our guests. We will now be taking a short break from releasing episodes, but we will be back soon, bringing you more interesting conversations and insights from health leaders within this fascinating field. So please do give us a review and hit that follow button wherever you're streaming so that you can catch us whenever we are back. So today's guest is Dr. Shahnaz Hassan, who is a general adult consultant psychiatrist with a special interest in adult ADHD. She is a published researcher in the field of lifestyle medicine, and her practice in psychiatry takes a lifestyle approach, aiming to equip people with lifelong personal resources such as regular physical activity to manage their mental well-being. She is a qualified UK athletics coach, setting up and personally volunteering at a community-based weekly mental health support running and walking group, Run, Talk, Run, and Walk, Talk, Walk, and volunteers at the first NHS patient swimming group. She designed and delivers wellbeing workshops to healthcare staff. Shahnaz is also one of our Nutritank advisory board members, and she lives by what she preaches and is a keen triathlete herself and encourages others to find their passions in life to help them reach their full potential.
Shahnaz, welcome to the Nutritank podcast. It's an absolute pleasure to have you on.
The pleasure's all mine. Thank you for having me.
Now, I know that this weekend you've been in Paris. Do you want to tell our listeners and our watchers what you've been up to?
So I went to Paris to do the Paris Marathon. I often pair my holidays with some sort of activity, mainly because I just enjoy it and it's a way of life for me. So the marathon was absolutely brilliant. I love doing the big city one, and it's really nice to see like everyone come out to support, like from all walks of life. So it was an absolutely wonderful experience.
I know that some of the listeners will know, but for those who don't know, Shahnaz is the partner of Dr. Hussein Al-Zubaydi, who I interviewed previously in another episode. So I thought this would be a fantastic way to bring two sides of the same coin together in a way. So you guys are a bit of a power couple. What else have you done recently together?
Oh gosh. So last summer we did a couple of half Ironmans. We've both done a London Marathon. We've both done 2 full Ironmans together, a number of 5K and 10K races. We both started from a very sedentary position, actually. So people are very surprised when we tell them that story. We were the kind of couple that would just go to work, come home, quickly make some food, and probably watch Netflix, and that was about our evening. And then we sort of got into the activity world, and it's now just embedded in our life. And we both love it so much, and I wouldn't go back.
Later on in this episode, I'm going to discuss with you a bit more about that journey. But let's go back to the start. Where were you born? Where were you raised? Where did you grow up?
Yeah, so I was born in East London. I was also raised and I grew up there, but I'm second generation. So my parents emigrated in the 80s and settled here before having me, and I'm the eldest child. It was a very busy area to grow up in. And when I go back now, I think, oh, I wouldn't want to live there anymore. But my family is still deeply rooted into East London. It was where we lived, there was an integration of cultures. So that was quite nice for my parents, I suppose. But I've got a bit of a hybrid culture as well from being brought up here.
And so, what was your journey into medicine and becoming a doctor?
So I've always liked science. I really liked biology when I was younger. And as I delved more into science, I got quite interested in the psychology aspect as well with regards to mental health. And I've always been interested in mental health. I did special study components in it when I was at university and really enjoyed my placements there. I think that mental health is the core of our well-being, really. And if we don't have good mental health, how can we have good physical health? How can we eat well? How can we exercise? How can we prioritize all the things that are important? So, I love helping people to find better mental health and improve how they live their lifestyles for that.
That's amazing. And can you remember when you decided you wanted to become a psychiatrist and what that path was like for you?
Yeah, I think it was quite early on in medical school when I did my. As I said, I chose to do my special study components in psychiatry to get more exposure to it, and I just found it very interesting. And as I went on, I picked psychiatry placements in my foundation years. I was also toying with the idea of general practice because I quite liked the idea of maintaining my knowledge quite broad and being a generalist as well. But then I sort of fell more in love with psychiatry, and I decided to pursue that. And I have no regrets about pursuing that. I really enjoyed the training program, and I got to meet so many different people. And still, people come up to me and they think I might be surprised by what they're going to tell me, but I never am because I've seen so much.
When did lifestyle medicine come into the picture, and what's that journey been like for you?
So with lifestyle medicine, it was kind of my own journey first before it then went into my practice. So some years ago, I watched a health documentary actually about the benefits of exercise for diabetes, high cholesterol, etc. And the focus of the documentary was this doctor, the Van Torken brothers. He was trying to take people off meds, and he said, "I've got a no medication clinic. Who wants to come to my no medication clinic?" So he enrolled people on this clinic, and he prescribed exercise for them. And I was just shocked at the benefits of exercise for people's diabetes and hypertension and cholesterol. And now I come from a family where that's very prevalent. Like it's high, I'm at increased risk of diabetes as well because of my family history and my genetics. So then I thought, I'm young now and I feel okay. I'm not doing very much physically, but I feel okay. But it's going to creep up on me eventually. So I better start doing something about it. So I essentially did Couch to 5K on my own. I just trundled out, just see how it went. And eventually I just wanted to keep going and then just increase the distance and just snowboard. And I just felt so much better in myself in every regard, my mental health, my physical health, my mood, just how I was just so much better. And then I sort of looked at my patient population as well, and I thought, I really need to encourage them to find something like this as well, because these pills that we prescribe, yes, they have a role, but there's only so much they can do. And I was seeing that with the patients that kept coming back to me and saying the medication wasn't working. So I started then integrating lifestyle discussions into my consultations, and the benefits were massive. And the patients always came back and said that they felt better for doing exercise than not. Sometimes they needed a bit of convincing, but I'd sort of set a small goal with them. We'd agree a small goal, and they'd come back and they'd tell me, that it was helpful. So that I started to get a lot of reward as a clinician doing that. And more so than when I got the patients who I perhaps prescribed pills for, and they'd come back and they'd say, I was better for a few weeks, but now I'm back where I was. So it sort of started my own journey, integrated into care, and now I'm very much on that side of care. And while I do still prescribe pills, I always prescribe them with lifestyle advice.
Oh, wow. That's a really amazing message. Thank you for sharing that. I'm interested to know a bit more about the time when you were having those consultations. Did you have training in lifestyle medicine before having those conversations, or did you did you have them quite naturally with patients?
So, as you know, Ian, there isn't much training on lifestyle medicine currently in medical schools, and I think that's what we're working towards. So, I didn't actually have any lifestyle training before doing that, but because I'd been on that journey myself, and I became interested in it, and also with the physical activity, I became more interested in nutrition and how to fuel my body better. And I started reading about ultra processed foods and things that were, had health risks and things like that. So I was sort of self-taught through my own experience. But I felt empowered that way to advise patients because I was also living that experience. I'd also come from a place where I wasn't doing like any physical activity. It wasn't a priority in my life to going on this journey. So I felt like I could give that advice.
So how have your colleagues taken this when you're discussing diet and lifestyle in this way with patients? Do they think it's a bit strange? Do they think it doesn't work? A lot of health professionals think that lifestyle medicine's a bit woolly.
I certainly haven't been, my colleagues certainly don't have the same enthusiasm. Some of them do, it's not everyone, but I do wonder if there is a bit of skepticism about it because it's not, sort of pills are evidence-based, they've gone through research and we know that they create this percentage of effect. But we do know there's lots of research in lifestyle medicine as well, but it's not as widely put out there. When you go to a conference, you'll have a drug company talking about X drug made this many symptoms better. You don't get the paper on nutrition or the paper on exercise. So I think there isn't as much availability of that information for people to fully back it. And also I find if you don't experience that yourself or you don't live some of it yourself, you're in a more difficult position to sort of understand the benefits and therefore advise on it. So I've been quite protective over my patients. I don't, obviously don't mind them seeing other clinicians, but once I sow the seed of change with lifestyle, I like them to come back and see me because I will ask them about it and they know I'll ask them about it. And they sometimes want to tell me that they've done something and they've made this change. So it's nice to go on that journey with them.
So let's talk about one of these journeys. Do you have a patient in mind who you could just discuss, without giving away any confidentiality?
Yeah, I have a wonderful patient who I was extremely proud of. He came to see me for a ADHD assessment, and part of all of my assessments, I have in my template, I've got lifestyle. It's in my reports. Everyone gets asked about lifestyle. So he was already on this journey of change. He was a heavy chap. He was about 140 kg, and he wanted to lose weight. And he told me that he'd started walking every day, and his aim was to do, I think, 5K or something of walking every day. And I was really supportive of him, and I really encouraged him to do that. And he'd also said, I'm going to cut down on ultra processed foods. And I said, well, are you going on a diet? And he said, no, I'm just going to cut out sugar and, fast foods and things like that. And I was really impressed because we all know that certain diets are hard to stick to. They can be restrictive and they don't have, long-term effects. So when he said, I'm just going to cut out the bad stuff, I said, that's really good. So he kept seeing, I diagnosed him with ADHD and he kept coming back to see me with his, for medication titration. And part of the assessment, we weigh patients because the medication can cause appetite loss. He didn't have appetite loss with the medication, but he was intentionally losing weight through diet and exercise. And I think over about 6 months, he lost maybe 2 stone. And every time he'd come and see me, he'd want to show me his app where he'd been measuring his weight, his body composition. He had a body composition scale at home. And I was just, I was so encouraging of his efforts and I was really impressed at his consistency and his persistence at it. So yeah, he's somebody that I will always remember because he had, even though he was starting from a really difficult place because he was really quite heavy, he had so much drive to even just lose a little bit each time he came to see me. And he would say, I feel better, I can sleep better, I feel physically fitter, the mental health is better. And sometimes when he had stresses and things going on, I said to him, what do you find helpful when you feel stressed or you have negative thoughts? And sometimes he would say, I like going out for a walk. And that's such a positive coping mechanism. When we studied for our MRC Psych, we learnt about psychological coping mechanisms. And one of the most effective ones is channeling stress into exercise. So I always tell patients to try and find something that they can do that will get their heart rate up, and they always feel better.
That's a really inspiring story. Thank you for sharing. Are you a healthcare professional looking to elevate your knowledge of nutrition and lifestyle medicine? Nutritank CIC wants to empower you to have the communication skills and knowledge of lifestyle medicine to improve your patients' health through free CME accredited webinars hosted every Monday evening. Learn from leading experts in the field and gain access to cutting-edge research and best practice. Here's what you gain through our webinars. Enhanced knowledge of nutrition and lifestyle medicine and applying it in clinical practice. Continued medical education credits to maintain your license. And free access to a library of previously recorded high-quality educational webinars. Take action now. Register for upcoming webinars or become a member at nutritank.com. The links will be provided in the show notes. Invest in your clinical practice and patients' well-being and fuel their health with Nutritank CIC. You touched upon there a couple of questions or a couple of reflections that you provide your patients. Could you give our listeners maybe an overview of some of the questions that you do ask every single time you have a lifestyle conversation with a mental health patient?
Yeah, so I always ask them about their sleep. I always ask about exercise. I ask about diet, substance use, and also caffeine use. I think often we forget about caffeine as a substance, but if you're having caffeine late in the day, or if you're having lots of caffeine, that is going to impact your energy levels, your mood, and your sleep. So it's always important to ask about that one, especially with the ADHD medications as well. So based on what they tell me, I'll work with them depending on the feedback they've given me. And I also ask about their diet. I sort of ask broadly, what's your diet like? And then sort of try and narrow it down to what kind of foods they're eating. Are they preparing their foods themselves? Are they having snacks? Because I think a lot of time we get people who struggle with their weight. A lot of my patients do as well. They'll say, well, I can't lose weight. And then if you break it down a bit, you find that they're restricting meals, but then they end up snacking. So it's about discussing with them, having prepared fresh, wholesome foods to try and set them on that journey. And I also don't discourage them to calorie count or be very specific with what they're eating. And, if they do sort of slip up and they want to have, something unhealthy, then that's okay. And not to beat themselves up over it. They're human at the end of the day, not to be disheartened and just start again.
Well, yeah, no, that sounds like some really clear points that we could take away and start practicing tomorrow. And it doesn't even, it doesn't have to be doctors asking these questions. It can be all members of the multidisciplinary team.
And I think the importance, and I was going to say, I think the importance is keeping it simple for people, because, there's lots of stuff out there. And for example, I had a patient like not that long ago said, is there specific diets for ADHD? And I said, well, obviously there is things that can help with ADHD, but just keep it simple, have whole foods, look at the Eat Well guide and the plate, and try not to have too many of this and too much of that. Because once they start thinking, I need to have foods that have this in it and that in it, then it becomes stressful. And we want this process to be easy and to be something that they just live and maintain. I once actually had a consultant who went on, she was my trainer at the time. She'd lost lots of weight. She'd gone on this, I called it a diet. And she said to me, it's not a diet, it's a way of life. So she had just changed how she had eaten, and that was how she was going to maintain things. And that really struck a chord with me. And I thought, yes, this has to be a way of life. We just have to embed our habits in, really, and with patients, it just needs to be simple.
Yeah, that's really powerful. Definitely moving away from this diet paradigm and into complete changing large parts of our life and reforming our habits. And I know that that's what happened with yourself and with your partner Hussein. So Hussein had I hope he doesn't mind me sharing, but he does share it publicly. He had a health scare at one point, and that was his turning point. So could you provide a bit of information on what it was like from your end in terms of seeing someone transition like that?
I mean, I'm really proud of how far he's come. I got on the bandwagon first, and he sort of watched me, and he says that I didn't push him to do anything, but he started to change through observing my behavior and how I was doing and how I was feeling. So it was nice that he got on. I think it's important that you have your own reasons. It's fair enough telling somebody you should do this and you should do that, but once somebody has a reason to do something, they're more likely to do it. So he found his reason, and he transformed his life. He's better at nutrition than I am now. He would tell me, don't buy that pastry, or don't have that. So he's much better. So it was really powerful, and I think for both of us as well now, we're at that age where our parents are getting a bit older, and we don't blame them, and they had different upbringings to us, but we can see the impact of lack of lifestyle intervention has had on them. And they're nearing their 70s, and my mum, and he won't mind me saying, his dad, they're pretty much very limited in what they can physically do because of weight, because of health issues, a lot of which has been could have been prevented with lifestyle intervention. So we think ahead now to the rest of our life. I think when I was in my 20s, before I went on this journey, I thought it was probably invincible. I'm going to be like this forever. But it creeps up on you, and you see your parents getting older, and you think, well, actually, I'm not going to be like this forever unless I do something about it. So initially, my biggest drive was, I want to complete an Ironman, or I want to do this. But now my actual reason is, I want to be healthy in old age. I want to be able to go on hikes and do my own shopping and go to the gym. That is driving me more than anything else now. So it's interesting how my goals have changed, but I suppose there has to be a spark somewhere that starts it.
That leads me quite nicely onto my question around, if someone listening has someone close to them, be that a family member or a friend, who's struggling with their mental health, how can we support them?
I think obviously listening and making them feel heard and not being dismissive. I think sometimes as humans we can, it's normal. We can be quite insular, and we think a lot about ourselves, which is good. But sometimes we then find it hard to appreciate maybe what somebody else's experiences or what they're going through. Like, for example, I used to be quite harsh on my mum, because I was like, why won't she lose weight? She's got osteoarthritis, because she won't lose weight. But then over time, I've sort of thought about it more, and I tell her and nothing happens. And I thought, well, she's got a different experience. Her life has been different. For her, maybe food is a coping mechanism. It's an outlet for her because of the stresses that she has, and she doesn't have the coping mechanisms that I have. So it's trying to be a bit more understanding of the other person's journey and being non-judgmental, first of all. And second of all, I suppose it's empowering them with information and just resisting giving too much advice, and let them take that information away and decide for themselves. And leading by example, continuing to live healthily and as well as you can. And, they might pick up stuff from you. And I think that's the best advice, because I think as a psychiatrist early on, I had the tendency to sort of give advice. And I do, obviously, if I'm asked for it. If people say, have you got any specific recommendations? I will. But I've moved more towards a empowerment sort of model of consultation, where I will just guide them, but ultimately the decision has to be theirs.
Exactly that, the writing reflex. I've seen it so many times with maybe an older generation of consultants telling a patient living with obesity that they have to lose weight, in the hospital bed. And I don't think, it's really ever been very successful or effective. And it can work for some people and some patients, but on the whole, it's probably more damaging. And there are some papers now a lot of research to show that stigma is really damaging, and we really do need to make a stand against it.
And I think also it's trying to encourage the other person to explore. Sometimes I'm tempted to. I've listened to their history. I can see what needs to change. But if I say you need to do this, it's not going to sit. But if I say, what do you think could help? And if they say to me, I don't know, I'll say, well, think about it, write it down, take your time, and we'll discuss it next time we meet. Because often there is something, but maybe they can't think of it when they're on the spot. Maybe they need some time to reflect. And, I sort of give them pointers. I say it could be something really small, such as getting out of bed at a certain time each day or going outside for 5 minutes. You don't have to set yourself a big goal, but just think about something that you might find helpful and we'll talk about it.
Have you found that these conversations are taking a lot of time? The lifestyle portion of the consultation, does it take longer than 10 minutes or can you do it, within 10 minutes?
I think you can do it within 10 minutes. I think it depends on the person and how much they want to talk about it. I think if you're going from someone who is, there's a lot of change needs to be made. I think you just need to sow the seed a little bit and then work on it and chip away at it each time you see them. But if some people are already motivated and encouraged, you can spend a bit more time talking to them. But you can definitely make a change in 10 minutes. You can just pick one aspect of something that you've noticed and just have an open discussion with them about it. So, it's about making small changes each time. I think a lot of my patients with a lot of ADHD, people are a bit all or nothing. They'll say, I would want to do nothing or go at 100%. I'm like, you can't do that. You can't go from 0 to 100. So you have to have small steps along the way. And, in 10 minutes, you can just decide with the patient one thing or one goal or one thing they're even going to think about and come back to you about.
Now, you've discussed lifestyle medicine in your own practice. I'm just wondering, psychiatry as a whole, how is lifestyle medicine and integrating in more generally within psychiatry? Are you seeing movement in the right direction?
I think it's very variable on trusts. I think the financial pressure that NHS has been under has been difficult. When I first started psych training, we used to have activity workers on the wards, and they would do things like artwork, crafts, things like that with patients. And we also used to have a walking group, actually. But then we lost some of that staff, and then there was more red tape around the safety of taking psychiatric patients out for walks and things like that. There's a tennis court, but then they were like, we can't give them rackets and all this stuff. And it was there is a lot of red tape. I tried to actually start my own walking group within the trust, but I was met with a lot of like, you need to do this risk assessment, that risk assessment, blah blah blah. So I think we could do more with what we have. We just need to be a little bit willing to take risks sometimes. There's a lot of talk about positive risk taking in psychiatry. We do it all the time. We do mental health act assessments for patients who presented in acute crisis and we discharge them from the hospital. So we're comfortable taking positive risks, but for some reason with other things we're not. So I think we need to change our approach a little bit. There is a trust, I can't remember which one, I think it was in London, that started incorporating walking therapy sessions as part of, you might have heard of IAPT, but they're the primary psychology service access point in the UK. So their IAPT was doing outdoor walks as part of their therapy. So we're getting there. There's work to be done, I suppose.
Is there any interventions that are going on in the UK, be that lifestyle medicine for psychiatry, that you're really buzzing about, that you're really excited to share?
There's a trust that is looking at outdoor swimming for depression. So they're recruiting now. We know that the massive benefits of open water swimming, both the cold exposure, the environmental aspect, being in the water, the social aspect. So I'm really interested to see what that study shows. So I think they are recruiting. It's been promoted by Swim England at the moment. So if we have some evidence base that says swimming is really good for depression, then maybe more psychiatrists will feel more comfortable recommending it. I'm pretty sure it's going to say that.
The information you provided, I know for a fact you've given such an amazing array of fields. I know you wear a lot of hats. Outside of work, could you provide our listeners with a bit more information about what you do outside of work, your passions?
Yeah, so I mean, all my outside of work passions are mainly physical activity based. Hussein and I started a running and walking group in primary care about 4 years ago. I think this is really where I saw lifestyle medicine in practice in an NHS setting. So I know it's achievable. And, I love that walking group and that running group, because not only do I see people get better, I see people form connections with each other, and it actually makes me feel better. Sometimes I've had a stressful day at work, and we all get that feeling, we can't be bothered, just want to go home and sit on the sofa. But I'm like, no, I'll go to the running group, and I always feel better for it, always. So that's something that I very much enjoy doing. We even got Christmas cards from patients saying, "Thank you so much. This has made a difference to my life." And you know, they became, beyond patients, they became acquaintances, almost friends. One of the girls in our running group, she told me she was in an orchestra and she was playing. So I went to see her, and we do stuff like that. We integrate with them, and you get to know people on a human level. And I think that's, you don't see that much when you're in a consultation with them. They've also got a hat on in a consultation with you. It's very formal. But when you take that barrier away and you just talk to patients as just people, you learn so much. You learn so much from them. So I love doing that. And recently we launched a swimming group as well. So that's been useful, because a lot of people have been anxious about running and walking because of various reasons, pressure on their joints, cardiovascular fitness. Or swimming, it's just perfect. Even just getting in the water, even if you're not going to exert yourself cardiovascularly, just being in the water is therapeutic. So that's another thing that I do outside work. Obviously, I'm advised for you guys as well, because I'm very interested in how we can incorporate lifestyle medicine into medical schools, into training of doctors, and into wider practice. We really urgently need to do that. And of course, I have my own interests, which take up a lot of my time: my marathon training, my half Ironman training.
It's fascinating there. You're talking about the patients and the stories, the positive stories that have come out, those community initiatives from primary care. You don't really hear those life-changing stories when it comes to talking about the latest technology and health. Do you know what I mean? What do you think? I mean, we are now gathering pace here in terms of the next technology coming out and that being used for the elixir of health and going to revolutionize health, the next app, the next wearable, the next test. But what I'm hearing is actually community, initiatives like this where people come together. That's where the magic happens. What are your thoughts?
Yeah, 100%. I don't know if you've heard of that Harvard longitudinal study of health. It was an 85-year long study. They looked at, mainly they've got a whole website now. I think they're doing a second generation study, but it was young men that they recruited into the study, followed them over their lives for about 85 years. And they found that the biggest determinant of wellness was social and community engagement. And we know that social isolation is a massive problem now. 1 in 4 adults globally report that they're socially isolated. That's a World Health Organization stat. And the World Health Organization has also recently commissioned a review to prioritize this issue globally, because it's causing health problems. When we're lonely, we feel stressed, and that stress response is not bad. It's not good for our physical health. So it's a cascade of problems. So yes, technology might have a role, but I don't think there's anything that can replace having an interaction with another human being, and being also in an outdoor space. So I think a lot of community interventions that encourage people to get outside of their homes and go somewhere else and meet someone else is so powerful. I think we can use technology to help connect. I was recently at an aging fit conference where the focus was technology, but there was a lady there that I met, and she was using her technology to encourage people into open spaces that might feel anxious about going into open spaces. So the app was mainly looking at, so you could see a picture of the environment, you could see the walking routes, you can see where the toilets were, where refreshments were, things like that people might be anxious about leaving their home about, that we don't necessarily think about. And if you have a bladder issue, you might not want to venture far from home. You need to know where the toilets are, that kind of thing. So I think we can utilize technology like that to support social connection, but we can't rely on it instead of social connection.
That is, yeah, no, that is so true. And that's a really great way of explaining how technology can be
used in harmony with, social prescription and community initiatives. Let's talk about your interest in sleep. I'm fascinated. I watched your webinar that you delivered for the Nutritank network. You can find it on our website. It's accredited with CPD points. What is your definition of sleep?
So there's no definition of good sleep.
Mm-hmm.
And also the amount of sleep is something that people always are like, oh, how many hours should I get? Now, NICE guidance uses American Thoracic Society, which says 7 to 9 hours. But really what I say to people is, are you feeling refreshed when you wake up? Some people sleep 6 hours and they're fine, which is okay. So good sleep depends on how you feel, how it affects you. So because we know that bad sleep can create irritability. It can, make you feel sedated, cognitively impaired, all those things. So if you're not feeling all those things during the day, then you probably are getting a good amount of sleep. The reason I'm so interested in sleep is because as a psychiatrist, I hear it all the time. And I always get asked for prescription medications. I'm very proud to say I haven't initiated any Zopiclone or Z drugs or sleeping tablets for, ever since I was independently prescribing. So probably as a registrar onwards. I have obviously done, prescribed repeats of patients that are already on it, but whenever patients approach me with that, I always discuss with them a bit more about sleep and try and explain to them that these medications. And I think there's a bit of misconception as well about the medications from the public. I think they think doctors withhold it for I don't know what reasons, but I think we have to be transparent as to the reasons why we withhold this medication. So I will say to them, they have side effects. They do cause dependency. They don't give you natural sleep. So, it's not ideal. And, I might be met with a bit of resistance initially, but, I'd give them some sleep hygiene advice and tell them to go away and try that and come back. And then we'll take it from there, really.
Very nicely leads me on to my next question, which is, what advice could you give to our patients in terms of a healthy sleep hygiene routine for morning and evening?
So that's really important, Ian. A healthy sleep routine starts in the morning. I think often people think of it as a couple of hours before bed. But so, when you wake up, you want to get natural light into your eyes. That's really going to help you wake up, get you that cortisol spike to make you feel alert and sort of dampen down the melatonin that makes you feel sleepy. So, I actually sleep with the curtains open, and people are always surprised. They're like, "Oh, is it you or Hussein that likes the curtains open?" And we both always like the curtains open because when it becomes light, we sort of more naturally wake up. So obviously in the summer, I do sometimes sleep a bit less because the nights are shorter, but I feel like I'm more in sync with the light wake cycle. So that's really important. And if you have to wake up in the dark, we've all done that, junior doctors, early shifts and waking up at night, put lights on in the house, stimulate that release of the alertness hormones. Exercise is really good. Obviously, when you exercise, you generally, you need to recharge, so your body's more likely to want to rest. But also, it helps to clear out the sleepiness hormone called adenosine. So if you do that first thing, you're more likely to clear that away and feel alert. Even if it is just going for a walk, you don't have to go and do a 45-minute HIIT or something like that. Just get your blood pumping and get your heart rate up. Another thing is having coffee first thing as soon as you open your eyes. This is not ideal. I was in denial that I didn't know what was happening, but every sort of mid-morning after lunch, I'd feel very sleepy. And it was only when I started learning a bit more about the sleep-wake cycle that I realized it was probably because as soon as I opened my eyes, I go and put the kettle on. And that comes from childhood because when I was little, my mum would always bring me a cup of tea in bed, which is really kind of her. She obviously was doing it out of love. But I became so, like that habit became so entrenched that was just, as soon as I did that, I would be awake. And then I'd go and have the coffee. But when we went to Europe once, they don't have kettles in like the hotels and things. So I'd take my English tea bags and I wouldn't be able to have my tea. And so I just have to go on my run and do whatever I would normally do and then, go and get a coffee or a tea. So I started to feel better and I thought, I'm just going to keep this up when I go back to the UK. And I did. And it's been like about 6 weeks now. And it's still something that I have to resist a little bit, the reflex to go and have a cup of tea, but I have a bottle of water instead on the side. I'm like, I'll just have that first and then have my caffeine. So that will stop you from having a caffeine crash. Another thing, obviously, is food. There isn't any sort of research on foods that can help people sleep, but we know that having like severe calorie restriction, sleeping hungry isn't a good idea. So you shouldn't, essentially starve yourself. And a second thing is high fat, high carb meals can impair your sleep as well, especially if you have them in the evening. I've definitely noticed that if I've been out and I've maybe had something that is a bit fatty or a bit heavy, I haven't slept as well. So it's important. So nutrition is important for sleep. And you asked me about evening routine. So evening, we need to make sure that as I was talking earlier about the sleep-wake cycles, and ideally humans, we should sleep when it starts to get dark, but that's not realistic for most of us. Most of us can't just stop at, especially in the winter when it goes dark at 5. So essentially, what you want to do is try and minimize your light exposure in the evening. So you can use like blue light filters if you have to look at screens, but ideally you don't want to be looking at screens a few hours before bed. You can have ambient, if you're having the room lighting on, keep it low, keep it dim to try and encourage your natural sleep-wake cycle. Another thing is temperature. I have a lot of discussions with our friends about how hot they heat their rooms, especially with the price of gas now and things like that. But, to save money and also to help you sleep better, you don't really need to have the heating on at night. We never have the heating on at night because once you go to bed, you're fine. But also because if it's too warm, your body won't initiate sleep. There needs to be a drop in temperature for you to initiate sleep. Another thing you can do if you're struggling is having things like hot baths, herbal teas, things like that have all been shown to be helpful as well in the evenings. But essentially, you want to wind down. A lot of us now are quite stressed. Life is quite stressful now, and I think the stress hormones, they do keep you awake at night. We don't want a cortisol spike in the evening. So it's trying to find some time really for yourself as well.
Now, there's really amazing takeaways there. Hey everyone, I hope you're enjoying this episode so far and learning a lot. For those of you who are new listeners, welcome. If you're finding this information valuable, I would love for you to consider joining our regular listener family. Just hit that follow button wherever you're listening and you'll never miss a new episode. By the way, one of our main goals is to educate as many healthcare professionals as possible about the power of nutrition and lifestyle medicine. So if you know someone who might benefit from this information, whether it's a colleague, friend, or family member working in the field, please consider sharing this episode with them. Now let's get back to the show and dive deeper. A couple of questions specifically about those points that you made. What about alcohol? A lot of people say alcohol makes you quite drowsy. Does that help you sleep?
No. Alcohol is in the sense of, yes, it sedates you and knocks you out, but what it does is it knocks out the higher regions of your cortex. So it's just sedating you. It doesn't initiate the natural process of sleep. And alcohol actually impairs the part of sleep called REM sleep, which is rapid eye movement sleep, which is the dream stage of sleep. So alcohol impairs that. And we see if you have long-term alcohol use and you don't get enough REM sleep, what eventually happens is that when you're awake, the process of REM sleep is to create dreams, so you can get hallucinations while your dreams get acted out. And that's what we see in delirium tremens. So that's on the extreme end of alcohol use. So yes, while alcohol can sedate you, it won't give you natural sleep. And if you do drink or if you have had heavy nights, you might have noticed that after that you wake up about 4 or 5 hours afterwards after you go to sleep. And that's because it's initiated an artificial sleep, similar to having a Z drug. So Zopiclone, Z drugs, they do the same thing. They knock out the higher regions of your brain. So no, I wouldn't advise alcohol.
For any of those listeners out there who are just wondering, just in case, how important is sleep for mental health?
So there's a relationship between mental health and sleep, obviously.
Bidirectional.
Yeah, bidirectional relationship. So it's massively important. And as I said earlier, if we don't prioritize our sleep, how can we hit those other aspects of life? We know that we've all experienced a poor night's sleep. We feel groggy, we feel a bit short with people around us, our mood isn't great, we don't have the energy or motivation to exercise. And also we know that poor sleep can increase our hunger hormones and reduce our satiety hormones. So we eat more when we're sleep deprived. You might have experienced this on night shifts. I certainly have, where you get cravings for high fat, high sugar foods, and you want to eat more. So, it affects all that pillars of lifestyle, really. So if there was one thing that I would advise a patient to do before we go on to all the other aspects, is to try to get on top of their sleep as much as they can.
And what do you do? Do you discuss with them? Do you take a history and discuss with them all about sleep hygiene techniques, and how well are they receptive of those techniques?
Yeah, so I asked them. I sort of go through the routine with them. So I have asked them about exercise, I've asked them about diet, alcohol, caffeine. But then I would say, so what do you do before you go to bed? What time do you get into bed? Are you looking at your screen? Because if you don't ask these specific questions, sometimes people don't volunteer it because they might know that it's not good, and I'm going to tell them it's not good. So, ask those questions. We're all guilty of looking at our screens before bed. We all do it. And sort of find the bits that you think that they can improve and discuss that with them, and agree maybe one or two things, rather than saying, look, I want you to go to bed at this time. You're not allowed to look at your screen at all, and you have to do this, this, this. It's not going to work. So if you find, for example, your patient's getting into bed and looking at their phone for like an hour, maybe say, is there something else you could do to help you relax while you go to bed? Some people say reading. Other people say like doing puzzles, crosswords, things like that. So it's trying to, Hussein always says this, it's trying to add in a good habit rather than take away a bad habit. Because if you suddenly take something away, then it becomes harder than adding something new in. So if you say, look, you're not allowed to go on your phone, that's not as achievable as saying, well, why don't you reduce your screen time a little bit and then maybe spend the rest of the time doing this? So I think they're more receptive to it when it feels a bit more achievable and a bit more manageable, and also when it's personalized. So it's important to ask their history and ask what specifically do they do, rather than giving generic advice on sleep, because then they think you're just dishing it out because you have to. So it's trying to tailor it to them, and then it gets better received. I still have spent a long time talking to people about it, and then they'll still ask me for a sleeping pill at the end, and I'm just like, oh, okay. So it depends on the person, but generally I haven't had people take it negatively, and I think the general public and most people do know that these are the things that we need to do, so they're not really surprised.
No, okay. It's just unlocking that, giving them the initial steps to make those changes.
Yeah,
we could have touched on this before, but just could we go into a bit more detail on the exact process of sleep? It's very interesting for maybe listeners who don't know the full physiology, or the stepwise from non-REM to REM. Could you go through the phases for us?
Yeah, sure. So what happens initially is, as I mentioned, that chemical adenosine, it's a byproduct of neural metabolism. So when we wake up, our brains are working and they're producing all this adenosine. That creates an urge for you to go to sleep. So for most people, that's about 12 to 16 hours. Also, when it's dark, we release melatonin, and that also says, look, it's time to go to sleep. So our body gets signals telling us it's time to initiate the sleep process. So it starts initiating sleep. And what happens is the thalamus then starts to block out sensations. So you become sort of unconscious to the outside world. And then you go into a state of sleep. You go into non-REM first. So there's 4 stages of non-REM sleep. The first 2 stages are relatively light. So you're relatively, you might still hear noise. You might still wake up during that stage. Sometimes while you're drifting as well, you might have experiences, I have certainly, get a feeling of falling, and you might jerk, like catch yourself. So that's all happening while your body is transitioning between, being alert to being unconscious. You then go into stage 3 and 4 of non-REM sleep, which is very deep sleep. You're pretty difficult to rouse at this point. If you wake somebody up in non-REM sleep, they're going to be very, very groggy. And then after you've gone through those 4 stages, you go into REM sleep. So REM, as we said, stands for rapid eye movement. So what's happening is your eyes are darting around during this stage, but also your brain is really active, because you're dreaming. This is the dream stage of sleep. And what's really interesting is the brainwave activities during this stage are exactly the same as when you're awake. So your brain is as active as when you're awake, but your body is paralyzed so that you can dream safely, essentially. I think that's just really fascinating that animals do dream. It's just an amazing thing. So the reason that this happens, that we go through these stages, is because what's happening is that we're consolidating memories and we're learning through these processes, which is why they say sleep is important for memory and learning. When you go into non-REM sleep, the first 4 stages, you're left. So I always use an analogy of like a bush, like an untamed garden bush, and you want it to look nice and sculpted at the end. So that untamed bush is like everything you've processed during the day, everything you've seen, everything that's happened. You can't retain all that information in your brain space. You don't have the storage capacity. So your brain starts preening out bits that it doesn't think are important or doesn't think are relevant. And then what happens in the dream stage of sleep is often you'll find dreams are related to you. They're autobiographical. So those old memories get integrated with the new stuff of the day. So that way you form connections and you learn, and then that goes into your memory bank. So, and then the process goes back to more chucking out old stuff and then going back into more integration. So as the night goes on, you're left with more and more useful information that you want to retain. So you get more dream state sleep as the night goes on.
Oh, wow. It's fascinating, isn't it?
It is really mind-blowing.
It's amazing. I've just started reading Matthew Walker's book on the science.
While we sleep.
While we sleep. It's just got into it. So I've just watched your webinar as well. So I am going to be, I'm going to have all the facts by the end of that book as well. So yeah, thank you.
That book is amazing. Yeah.
So I think a lot of healthcare professionals will be wondering what they can do to mitigate the loss of sleep that occurs due to shift work. Do you have any tips for us?
Yeah, I mean, shift work isn't, obviously we have to do it, and it's not, it's not great having that disruption in sleep-wake cycles. And I think, when you are doing that, and I know it is encouraged to have naps when you are allowed. So naps can be useful to, if you are sleep deprived. In a normal situation, I wouldn't, if you were sleep deprived and you were able to get nighttime sleep, I wouldn't advise you have a nap. But if you're not able to get nighttime sleep, then try to sleep as much as you can, really, and when you can. And obviously, in certain cases, you can, if you need to, use melatonin to artificially start off that sleep-wake cycle once you've finished your shift, if you really have to. Melatonin is still early specialist, early initiation, but it is widely available in a lot of countries, actually over the counter. And it's, it's our natural hormone, and, we release that when it's dark, and it signals our body that it's time to go to sleep. So we can utilize that if we need to. And I suppose it's difficult with shifts, isn't it? It's about seeking opportunities to rest whenever you can, because when you do go to sleep, you will recharge.
No, that's brilliant information and advice. Thank you. Going to ask some questions we ask all of our guests. Now, our audience of healthcare professionals and change makers love to know what action they can do today in contributing to tackling lifestyle-related chronic disease in their workplace or community.
I think one of the most important things is to ask. We don't ask about it enough, I think. I'm very, as you said before, you asked me, do my colleagues ask about this? And I've made a point of putting it in my clinic letters and in my reports. And I have a whole heading, how we have past medical history, etc. I have a heading that says lifestyle. So I think, by asking, you're sending the message that this is an important aspect of the medical history. And this is important for your health. So, even if you're only going to ask about one aspect, find out what's going on.
That's amazing. So what one piece of resource or multiple pieces of resources could you signpost our listeners to in terms of lifestyle medicine in psychiatry and sleep?
So the NHS website has a sleep diary on it, if you Google NHS sleep. And at the bottom of that sleep diary is something we haven't touched on, but that's useful with getting a history of sleep problems from people as well. At the bottom of that, they've got really like clearly laid out sleep hygiene advice. So that's a good one to give your patients. Another one, obviously on the NHS website as well, is the Eat Well guide, which breaks down dietary advice, keeping it simple again.
Amazing. And what one self-care tip would you advise our listeners to start from today?
I would say it's a bit of a broad one, but I would say be kind to yourself, because I think sometimes we have such big aspirations, and that's good. And I think when you're coming from a place where a massive change is needed and you don't see change straight away, you feel frustrated and you give up. So I think it's about realizing that it's a journey and it's not a perfect journey. So, if you plan to exercise, I don't know, 3 times a week and you've only managed it once, instead of saying, oh, I haven't done this, be kind to yourself and say, look, I had a busy week, but I did my 1 session this week. So I have to work really hard with patients to get them to see these aspects of these changes, because as a psychiatrist, I hear a lot of what's negative, what's not going well. And sometimes I stop them and I say, wait a minute, what is going well? What have you done that is good? So it's remembering those things to empower you to keep going.
It's really inspiring advice and tips there. And if there's anyone listening who would want to know more about the sleep diary and the resources that Shahnaz has just mentioned, do go check out her webinar that she has on the Nutritank website. It's free to access, and it's a fantastic webinar all about sleep and how we can advise and at what we've just been discussing now. So yeah, go check it out. Thank you so much for coming on the show. Could you provide our listeners with where our listeners can find you online?
Yes, you can find me on LinkedIn. It's just Shahnaz Hassan, or you can also find me on Instagram. It's at Shana_H. So that's SHAHNA_H. So yeah, message me on either.
Brilliant. Thank you so much for your time and for coming on the show.
Thank you for having me. It was a pleasure.
We hope you enjoyed this episode. If you did, share it with your friends and family and drop us a review on your preferred podcast platform. Don't forget to follow the show on your favourite streaming platform and connect with us online to stay up to date with all the latest news and episodes. If you feel engaged with a particular aspect of today's show, then please comment on our social media posts for this episode. They'll be linked in the show notes. See you in the next episode.